We are set to step inside the world of virtual reality right now, but as Olivia Jakewith is here to tell us, this is no game.
It's not, Greg. Students at Maria College are, though, leveling up their nursing education with cutting-edge technology, and it's only continuing to evolve.
My name is Yogi. I'm going to be a nurse today.
The Andrea Lewis Sikh School of Nursing at Maria College in Albany, giving students like senior Yogit Joseph an extra level of clinical training.
It kind of gives you that real-time reaction of things that are going on instead of like practicing at home and just making up a scenario in your head.
The Center for Academic Innovation featuring a virtual reality nursing hub, complete with 20 computer stations and more than 30 VR headsets.
It allows the students to practice the critical thinking, the communication and collaboration skills before they ever meet their first patient. That way, they've already leveled up. Since you're dealing with pediatrics, you may want to raise the guardrails, for example.
Jason Coley is the director at the center, which, since opening in January, has already served hundreds of students.
In order for a nurse to become a nurse, they have to participate and complete their clinicals, which is X amount of hours they have to be inside of a hospital setting, working with real patients. The challenge is that because there is a nursing shortage, there's not a lot of nurses to spare time to mentor or watch over these other students inside their clinicals. And VR poses to be potentially one of the technologies that we can use to help address this problem.
Did they put on gloves? Did they administer the proper medication? How is the patient reacting? But Maria College President Dr. Lynn Ortali says this is in no way replacing work with mannequins and later actual patients.
It's just part of the scaffolding of the education we provide at Maria. So students are involved in the didactic, what everybody's used to, lecture, textbooks, but then they move into the virtual reality to really get a sense of how it actually works.
And they can do it together.
It makes you follow the step-by-step protocols in the nursing field, hand hygiene, introducing yourself, and you also get to work with other people too.
So here's the deal. You have immersed yourself, right, Olivia?
I have. I've done my best. I don't have any medical training
Okay.
here. So you're going to have to tune in next week for the second part of this story. Not only am I going to try this out for myself, but we're also going to see what the future plans are for this technology.
I know you're multi-talented. I'm sure it'll come out great. Thanks, Olivia.